Hello friends, I am Dr. Suryasnata from Jaypee Hospital. I am a senior consultant in microbiology and I am the coordinator for infection control and also for my lab quality. Yes, so I think quality, I sleep quality, I walk quality, and that's how I have reached hand hygiene. Hand hygiene is what is imbibed into us since childhood, but we need to incorporate it into our day-to-day activity. If you remember, in childhood we always told by our parents, अपने हाथ धो लेना, please wash your hands before eating food, please wash your hands after using the washroom. These are simple things which we had to depend on other organizations to tell us, and we forgot our tradition. So if we take forward our tradition and follow hand hygiene and teach our next generation hand hygiene, it will take us way forward in our day-to-day life as well as our healthcare. As far as healthcare is concerned, hand hygiene needs to be practiced at particular times, which again we were taught earlier to practice, but somehow it has got diluted, and if we can reinforce that, it will be very helpful to prevent a lot of infections which we deal, and especially our resistant organisms. I'm sure you all read that in the newspaper these days. You have this resistant organism, you have multi-drug resistant organisms, you have pan-drug resistant organisms. So just a simple exercise, if we do a palm to palm, a back to back, a web to web, a knuckle to knuckle, a tip to tip, a thumb to thumb. This takes us way forward. This takes care of all the dark zones of hand hygiene. Can we all raise our hands and practice hand hygiene? That will take us way forward. As we do hand hygiene, there are multiple options to do hand hygiene. We can use soap and water, we can use hand rubs which are alcohol based, there are alcohol plus disinfectant based. If you really ask me, even soap and water suffices. It's the most economical way of hand hygiene in our day-to-day life. Yes, in healthcare practice, probably a hand rub is what is required, because washing hands in between patients sometimes is practically difficult. So let's join our hands and do hand hygiene. When you are at home, soap and water. When probably in healthcare settings, probably a hand rub is more practically useful. So when you do again hand hygiene with soap and water, dry your hands properly, because a wet hand can again be contagious. So dry your hands with a clean disposable paper. That is the best which can be done. And if it's an alcohol based hand rub, please rub your hands, follow all the 6 steps. And yes, there are 5 moments of hand hygiene in a healthcare setup where a clinician or a doctor or any healthcare provider, even in home healthcare practices, it needs to be followed. The 5 moments are when you touch the patient, when you touch the patient environment, before touching the patient, or before you're doing any sterile procedure, or after exposure to any body fluid. These are all helpful moments of hand hygiene, and these are recommended by our WHO. So this has been studied and found out that if we practice at these 5 moments, the 6 steps of hand hygiene, we are the fighters or the warriors of infection.